Hello, I'm Manoj Karmakar. Welcome to ISSPS TV. I trust you are well wherever you are in this wonderful world. In this upcoming video, Dr. Stanley Lam from the Chinese University of Hong Kong is going to be performing a live demonstration of ultrasound imaging of the cervical spine and paravertebral region relevant for injection techniques in pain medicine. If you like any of our videos, do remember to subscribe so that you can get regular notification of any future uploads. Now enjoy the upcoming video. I think now, ladies and gentlemen, I hope you are still there. I can see that a lot of people are still logged in. We have an exciting half an hour, and I've already introduced to you Dr. Stanley Lam. He's from Hong Kong, a very well-known musculoskeletal therapist, a doctor par excellence, and now he's going to demonstrate to us all the ultrasound imaging of the cervical, lumbar, paravertebral, etc. within the half an hour period that he has. So, Stanley, take it away.
Thank you, Professor Kamaka, for your kind introduction. And during the next half hour, I'm going to lead you through all the cervical spine structures, especially all the landmarks, and then you're going to do the cervical spine intervention. So I will start with the anterior spine, and the home position and the landmark for all of us should be the chest iliac tubercle, which is the anterior tubercle of the C6, which is the tallest anterior tubercle in the whole cervical spine vertebrae. And this is C6, and this is the anterior tubercle, the chest iliac tubercle, and this is the posterior tubercle. And I would also like to give you a bit of the tricks of tips. You can see that our patient, we have on the ipsilateral shoulder, and then we have the patient, the model, a little bit of hyperextended neck, and then to expose the anterior structure clearer. Okay, sorry, yes. So a bit of the hyperextension will make the anterior structure clearer. So this is the tips. And then we have the anterior tubercle, posterior tubercle of the C6. This is C6 nerve root. And if we're going down, we're going to see the C7 is only with the posterior tubercle without the anterior tubercle, and that's the C7 nerve root. So if we keep going down, and then we're going to see the C8 nerve root. And this is the interscalene brachial plexus. So you have the anterior scalene, the middle scalene, and the posterior scalene, and you have the C8, C7, C6, and C5. So then we back to our home position, which is the C6 anterior tubercle and the posterior tubercle. And if we keep going up, we're going to see the C5 with the anterior and posterior tubercle, but much shorter than the C6. And we keep going up, you can see the C4, even shallower anterior and posterior tubercle. And after that, you're going to see before the you'll see in the C3 nerve root, you're going to see the carotid artery bifurcate to be the internal carotid and the external carotid. And then you see your C3 nerve root, which is with a very shallow foramen. Okay, so then we back to our home position. Then you can see underneath when I light up the pressure, you can see the jugular vein, internal jugular vein is right here. And right next to your carotid artery, you have the vagus nerve. And if I keep going down, then you can see the longest capitis is inserting both to the chest iliac tubercle of C6, and keep going down, it's inserting also to the longest colon muscle here. So at this longest colon muscle, if I go to the C7 level, as pointed out by Dr. Shankar, that if you want to do the stellate ganglion or lower cervical sympathetic block, the better position is to go to C7. Then you get underneath the prevertebral fascia. Be very careful about the inferior thyroid artery, which I'm going to show you that is in this thyroid artery, in inferior thyroid artery here. Then you can have that in view. Then you can go to this prevertebral fascia outside the longus colli muscle. Then you can do the injection. And you have to be very careful about another artery, which is the vertebral artery right here. Then let's go back to the B mode first. Then I'm going to show you a bit of the arteries in the anterior structure here, so which is relevant to the all the selective nerve root block. So if you go to the C8 here, you can see right next to the C8, anterior to that, you can see the vertebral artery, and together with the venous plexus, which is the venous plexus right here. If I turn on the color Doppler, you can see the vertebral artery here, and anterior to that, superior to that, you are seeing the vertebral veins. So it's a venous plexus. Then this venous plexus, pay attention to this one here. It's going to merge to the jugular vein here. So you can, and then this is the merging to the jugular vein. You can see all the valves of the jugular vein here. So then I go to this vertebral artery. In fact, branch out from the subclavian artery here. And after that, it's going to enter the transverse foramen below the C6 right here. So remember, there are variations. Some patients, they may not have the C6 the vertebral arteries going into the transverse foramen under C6, sometimes under C5. So there are a lot of variations, but in this model, we can see it goes into the transverse foramen underneath the C6. And you can also see there is another artery which is going together with the nerve root of C6. So you want to do a selective nerve root block, you have to be very careful about this artery right here. So in order to do that, I advise you to open dual mode. Then you can have the needle, and when you see this anterior and the posterior tubercle here, then you can just pivot the lateral end a little bit. Now you can see the C6 nerve root, the anterior tubercle, but I missed the posterior tubercle here. That's a little bit of pivoting. This is seeing both tubercle, but you're pivoting a little bit of this lateral part. Then you're only seeing the nerve root together with the artery. Then you can do your selective nerve root block here. Your needle coming from the lateral to medial, then you can do the selective nerve root block. So that's for the C6 nerve root block. For C5, very similar, but you have to be very careful about the artery going together with that. And remember this artery, the spinal cord receives a lot of blood supply from vertebral artery, especially the upper part of the spinal cords. So don't damage or don't do any intravascular injection to that vertebral artery. If I turn the probe 90 degrees this time in the long axis, and then I'm going to see, you can see the very tall chest iliac tubercle of C6. And you can see the vertebral artery and veins going underneath and inside the transverse foramen. This is C6, and that's a C5. If I keep going up, that's C6, C3, but C4, sorry. And if I keep go more medial, you can even see underneath the longus colli muscle, you can see the disc, because you're seeing this the chest iliac tubercle, that means this is C6 vertebral body. So this is C6-7 disc, and that's a C7-T1 disc. And this one is C5-6 disc. And this is the inferior thyroid artery right here, and that's the carotid artery. And then if I back to the transverse view here, then we can see, oops. And back to the transverse view, then you can see this is the thyroid, and that's the disc. And this is spinal cord right here. And this is the right side mass, and that's the left side mass of that. And you also have the trachea here. Can you swallow? And that's the air inside the esophagus. And this is a thyroid, and you have the stylothyroid. You have the sternal head of the SCM, and that's the clavicular head of the SCM. And this is the omohyoid muscle here, and that's the anterior side, I think. And remember, you don't damage those artery, the reticular artery going together with a nerve root. Okay, can you turn to the side? This time, move backward towards me a little bit. Okay, good. And then when we do the lateral side of the cervical spine, so the right side is cranial and the left side is caudal. If I put the transducer right at the lateral part of the cervical spine, you can see this is the occiput. This is the occiput. And that's a C1 transverse process. And in fact, you can see the C1-2 facet right here. And the first prominent facet you can see is the C2-3 facet. This is C2, and that's C3. And this is C3. And this one right over the C2-3 facet, you can see this is the third occipital nerve, usually is right over the C2-3 facet. And you also have the other branch of this C2-3 in this valley here, and that's a C3-4 facet. And inside the valley here, you can also see the medial branch, and this is C4-5 and C5-6, and this C6-7. And at this point, you can also see another artery which is going posteriorly right here. If I turn this into long axis here, then you can see that's the deep cervical artery. This is the deep cervical artery, and it supplies all the muscles in the posterior part of the neck. And this artery also going to separate the semispinalis capitis and all the deeper muscles underneath it. So it's a fascial plane of that. And this artery is also going to give branches or contribution to those reticular artery together with the anterior ascending cervical artery, which is anterior to the facet, but the posterior to the posterior tubercle. So this is one of the posterior tubercle, another posterior tubercle, and sometimes you can see another artery right here, which is the ascending cervical artery on the posterior part of that posterior tubercle, but anterior to the facet joint, which is not very well shown here. So let's back to our lateral view of a lateral side of the neck. So if we want to do a intervention to the joint or to the medial branch here, For example, when we want to do a C3, which is the third occipital nerve right here, we can do a posterior to anterior approach with the needle coming from here. When the needle enters the patient, you can turn to the long axis, the in-plane technique. Then you can see the needle, the whole trajectory of the needle to that facet and also the third occipital nerve. But you have to turn on the power Doppler a lot of the time, and then you can use the dual mode, and you can do your injection to intra-articular or to do the medial branch. But if you can also do another approach, is the anterior to posterior approach. You can have that facet or the medial branch, depends on whether you're doing an intra-articular injection or doing a medial branch. You can also have the needle coming from anterior to posterior using outer plane technique. Most of the time in our locality, a lot of time in using a 1-inch needle, you can get to that because it's very shallow. From the skin to even to the medial branch, it's only 2 centimeters. 1-inch needle is enough to do the medial branch and safely. Okay, let's back to this a bit of structures in this view here. And we have this right cranial to the C2-3 facet, and then we have this muscle here, which is in fact the obliquus capitis inferior muscle. And above the C1, in fact, you have another muscle which is called the obliquus capitis superior muscle. So the C1 is the bifurcation. You can see 2 of that. And when you see the artery underneath the obliquus capitis inferior muscle, in fact, this is the vertebral artery again, which is just getting through the transverse foramen for this C2. So, and then also the C2 nerve root is underneath that and then medial to the vertebral artery. So this is C2 nerve root coming out from here. And C2 nerve root, remember, this is C1, C2, 3, C1, 2 facet, which the C2 nerve root is underneath the C1. And then you can see the dorsal branch of that dorsal rami will become the greater occipital nerve. And the ventral rami become the lesser occipital nerve. This time, I like to show you that you can see, in fact, this one here, this is the C2 nerve root. And you can see it comes out and it gives this greater occipital nerve right here. And this greater occipital nerve here, if I keep going to go medial, it's going to wrap around this inferior oblique, and it's going to go midline, and it's going to pierce through this semispinalis capitis up, and then also the upper trapezius. If I turn the transducer into the transverse view here, and this time I'd like you to line prone, please. You go under chest. Okay, 盡量 flexible again. For the if the patient is lying prone, let's do a bit of the landmark. This is the occiput. Then we have the very thin layer of the upper trapezius, and the muscle underneath it here. This is the medial belly of this semispinalis capitis, the lateral belly of the semispinalis capitis, and if I go more lateral, and this is the splenius capitis right here, and this is the longissimus capitis. And you also have the semispinalis, the sternocleidomastoid muscle, the SCM right here. And the right posterior to this SCM, you can see a nerve fascicle right underneath the skin here. So in fact, this one here, this is the lesser occipital nerve. And remember this lesser occipital nerve, it comes out from the ventral ramus of this C2, and it's going to wrap around the levator scapulae. Then it's going to go to the posterior border of this SCM, and it's going to surface to the post-auricular part of the occiput. So this is the lesser occipital nerve right here. And this is, and it's going to wrap around here, and then the levator scapulae. So this is the levator scapulae from the C1 level. Then we're back to the midline here. And we go to the occiput again. Then we go caudal. This time you're going to pay attention. The first bony landmark you're going to see is not a process, but it's a ridge. So this is the ridge of this C1. So this is C1, the whole part of this C1. And right beneath the semispinalis capitis, you also have another muscle, which is the here. Is the shape of that is not very clearly shown here, but it's when I turn the probe the transducer 90 degree, you're going to see better. And this is the rectus capitis posterior minor muscle, and the major muscle is much bigger. It's going to insert to the C2. This one is the major muscle. Rectus capitis posterior major is going to insert into the C2 spinous process, which is the bifid spinous process. This is the one, and this is the other one. It's the bifid spinous process of C2. Then we can go to C3. 我低少少個 flex 多少少啊。OK， 唔該 ，thank you。Go back to the C2, and then go to C3, and then go to C4, C5, C6, and P1. P1 right here. So when we go to this, the spaces between the spinous process here. In fact, when we increase the depth and when we lower the focus, increase the gain a little bit, now you can see if the home position for this posterior suboccipital region is I come from the C2 spinous process and then go to C1 transverse process. Right here. From the C2 spinous process and then to C1 transverse process. And then we are seeing this, the whole length of the muscle of this obliquus capitis inferior muscle. And underneath it, you also have the vertebral artery. You have the vertebral artery and also the C2 nerve root underneath. And here you can also see this is the spinal cord, very deep. And you also see the myodural bridge right here. And this is above it, you can see above the obliquus capitis inferior muscle, And you can see one nerve, which is the right here. This is the greater occipital nerve. You can see this greater occipital nerve, in fact, is coming from the C2 nerve root, and it's going to wrap around this inferior oblique, and it's going to go into transverse this the semispinalis capitis and the upper trapezius to surface to the skin. And right next to the C2 spinous process, you are also going to see another nerve root, another nerve, which is the third occipital nerve, right next to the ligamentum nucleum here. So if this time I try to turn into the long axis of the greater occipital nerve right here, and then you can see that this greater occipital nerve is going to wrap around the inferior oblique, and it's going to surface, passing through the semispinalis capitis and the upper trapezius to the skin here. Okay, so this is, and then if I turn this greater occipital nerve into long axis, and this is the inferior oblique, and then that's the rectus capitis posterior major muscle. And this time, I like to go to the long axis. If I go to the long axis, this is the upper trapezius, and that's the semispinalis capitis. And then you can see this time, this is the C1. And this is the C2 spinous process, and that's a C1. So from the occiput to C1, this time you can see the rectus capitis posterior minor, and this is the myodural bridge. And you can see if I go to more lateral, this time you're going to see another muscle, which is coming from the occiput. Which is coming from the occiput right here, and then to the C2, so which is the rectus capitis posterior major. But after you miss the C2 spinous process, the muscle you're going to see is the inferior capitis, the obliquus capitis inferior muscle. You can see the myodural bridge again, and this is the posterior dura, and that's the spinal cord inside. So if I go more, and then you can see a pulsation, which is the deep cervical artery, which is going to branch, to anastomose a lot of time with vertebral artery or the occipital artery. So, and then if I go more lateral to that, and then in fact, I'm going to see, if I turn on the power Doppler, and then you're going to see the vertebral artery again above the C1, which is the suboccipital part of the vertebral artery right here. And the C1 nerve root is coming out together with this vertebral artery, passing through the atlanto-occipital membrane. And then also if I go more lateral, you can see another artery, which is more shallow, and which is the occipital artery. And then in between these two arteries, and then you can see this is the occipital atlanto joint right here. This is C01 facet right here. Okay, so let me back to this other parts of this. If I go to the long axis in the midline, and then we can see the occiput, we can see the C1, the posterior ridge of that. We can see the C2 spinous process. We can see the C3, the bony landmark. If I go more lateral to that, in fact, we can see, if I go and then do a paramedian sagittal, and then I'm going to see if I keep going more lateral, this is the posterior part of the facet joint, and this is C2-3, and there's C3-4. But if I tilt the transducer more medial, then you're going to see the epidural space of the cervical spine. You can see the ligamentum flavum here, and this is the posterior dura, and this is the anterior dura, and you can see the vaguely you can see the pulsation of the spinal cord, and you can see the epidural space, very thin part of the space between the posterior dura and the ligamentum flavum here. So this is the posterior side of that. And when we turn the transducer 90 degrees again, this time I'm going to show you that and then this is you can also see this is the ligamentum flavum and also the posterior dura, and you can see the spinal cord with the pulsation inside. This is another one, and in between you're seeing the lamina of the cervical spine, and this is another lamina, and in between you see in the spinal cord. Okay, so when I back to this posterior muscular structure, you can see if I keep going from this C6, 7, you can see the artery which is pulsating here. And that's the artery separating the semispinalis capitis and the fascial plane for all this deeper muscle like the semispinalis surfaces and the multifidus muscle. And remember, this bifurcation plane is also for all those medial branches trying to go midline. The medial branch is going to go inside this fascial plane. So that's another site you can see the medial branch. And also for the medial branch, because it's another view you can get is when you get to the facet joint, then you can get to the posterior tubercle of that. So you can see the facet, you can see the posterior tubercle of this one of the cervical spine. Then you can see the posterior ramus of this the spinal nerve root is inside the is just above this posterior tubercle. So that's another approach you can get to the medial branch. And when we do this transverse view of this, when you see the facet, you can also see the double contour sign of that. You can see this is, if you are seeing the one facet, you can see this is the inferior facet and the superior articular pillar and the inferior articular pillar. That's the reason why it gives you this double contour sign. I think that's pretty much for this demonstration for this. How long I think the time is on.